Hey, everybody. I am talking about vaginas, but I'm not really talking about vaginas. AI has me talking about vaginas. It's not me. It is not me talking about vaginas. Check it out.
We are live with Gross Anatomy Podcast,
where we explore the sights, smells, and sounds of medicine, how it relates to movies, TV, books, podcasts, and the world around us. And I am Dr. Jason Cohen.
And I am Lauren Taylor. And today, Dr. Cohen was just telling me pre-med got out a little late. Was it interesting? Was it a guest speaker? Anything you want to tell the audience?
Today was one of our Wednesdays, we actually go to the simulation center at the hospital, and the students get to do hands-on playing with the laparoscopic equipment, with the simulators, with the Da Vinci robot simulator. Then they also get to do ultrasound. So today is the one hands-on day where they get a sense of what it is we do. So they get to do ultrasound and ultrasound each other, and we get them on the Da Vinci, and they get to do robotic simulations, and then we do different fun exercises with the laparoscopic equipment. So it's a pretty cool thing. Certainly nothing I ever did as a student or even as a resident or any of that. One of the things I tell the students is I practiced on live humans. We didn't have any simulators or anything like that. It was just on people, and luckily we didn't kill anybody.
Yeah, well, that is an exciting day. I bet they all really liked it. Can you tell the students who like it more than the others?
Yeah, for sure. And it's also interesting to see the students who are better than the other ones, technically. It's interesting to see who's got skills. It's whoever's good at video games maybe has skills too, which is interesting.
Oh, yeah, I wouldn't think about that. Everyone's like, video games are a waste of time. Maybe not.
No, not necessarily.
Okay, so you had a good day with the pre-med students. I'm glad they all had fun.
Good day with the pre-med. You know what? Another thing today was, I always talk about when I have my students with me in the office, how for whatever reason there often seems like a theme to the day. There always seems like a theme to the office day. And today, for whatever reason, one of the themes in some of our patients was pelvic floor weakness, and in our female patients, pelvic floor weakness and actual prolapse. And several patients had that, it was kind of weird that it came up with multiple patients who weren't seeing me for that. They were seeing me for other things, but sure enough, the theme of the day, pelvic floor weakness. And we've actually talked and had on our show a few doctors, Rebecca Lane, and I think we've even had a couple other OBGYNs talking about pelvic floor. We've had Suzanne Gilbert-Lenz. So go back to listen to those episodes. Could be kind of interesting.
Yeah, Rebecca Lane was not that long ago, and she was very insightful.
Yeah, so I actually gave the patients the names and numbers of different urogyns, including Dr. Rebecca Lane.
All right. Any other updates? Because I want an update from you about a certain topic.
What do you got? What do you want to update me on?
Well, I was looking at the New York Times had this big video newsreel, and it was all fake health influencers, basically like fake doctors selling people products, all AI generated. Apparently this company in China is able to do 1,200 videos a day of videos that look American but are made in China. And there's only 40 people working at this place. They make 1,200 videos a day, and their videos cost like $10 each, which is like so much cheaper than shooting a real video. It's insane.
Yeah.
And there's barely any guidelines at all because it's online, because it's on social media, and it's not on TV. So they don't have to have all these guidelines. They don't have to have all these disclaimers. Nothing.
So what did you want to ask me about?
So I wanted to ask you, have you still seen your face? Did you actually report it? Is there any news update? Dr. Cohen is, he is one of the doctors that they have used his likeness and image. It's very hard.
Have you seen those? Have I sent you those videos? Have you seen those?
Yes, and we talked about it on one episode, and those videos really anger me because, you're promoting products you would never promote, saying things you would never say, but it sounds just like you, and it looks like you, and it's
it's pretty crazy.
Yeah.
I have this guys, the guys I grew up with, we have this guys WhatsApp group that we're constantly, on. And the other day, one of my good friends included on our WhatsApp group one of those videos of me. And he's like, Jace, come on, this is not appropriate for you. And he didn't realize. And then, they went through all the videos and then they realized that they're all fake. They're all AI versions of me saying things that I would never talk about. Like the big one is this one about vaginal health. It's the most bizarre thing. And then my kids had found, one of my kids' friends found one and sent it to me. And then my kid did a deep dive and is like, and here's Spanish, Daddy, right? They're ones of me speaking Spanish fluently.
But that's why I wanted an update. Did like you try to report it? Did anything happen? It's still out there?
I posted it saying it's saying it's not me, but I haven't heard anything back. Who the heck knows?
So that's also the problem. Apparently, there's no law against using synthetic people, which means fake people, but you're a real person. So actually, that's why I watched this whole New York Times news reel thing, is because I expected to see your image promoting some products.
And I wasn't there?
No, they didn't go into actual doctors being used for these products. They just went into how this Chinese company was making fake people and fake ads and how to spot it, but it wasn't even that helpful how to spot it. It was like basically a lot of them have an American flag like somewhere just in the background, or they have fake diplomas of the doctors, like when the doctors are saying they have fake diplomas.
And then there was another one like a year or two ago. One of the doctors I work with, a friend of mine, a colleague who I work with, said, "Hey, Jason, are you promoting beef tallow?" Did you ever see that one?
I saw that one. That one made me mad because it was like, that's not something you would eat.
I know. I'm plant-based, so that's the craziest. Yeah, there are a lot of, and that's a totally different company. There are so many fake me's out there.
I mean, that's what I was hoping they would go more into, but they didn't. They were basically like, look for if this doctor is suddenly in a grocery aisle or pharmacy aisle. Like I guess there's similar backgrounds to look for, but still, I mean, it's so hard to tell. They started with one video that I swear looked real. It was like an overweight couple. They looked just like, a normal couple. And then they were like, this is 8 days into us taking beetroot. And then it was cut to them 50 days into eating beetroot. And they looked like a lot trimmer, a lot healthier.
Wow.
And I know. And like beetroot, I was like, I always think like I need to eat more beets or radishes. I'm like, people could like promote to me like something like that. I mean, I wouldn't buy it just because I'm cheap, but still, like, I can see how people fall for it.
Yeah, for sure. That's nuts.
Yeah. And then they were interviewing this one lady, I guess, who took something for inflammation because, they target you with all these algorithms. So she kept seeing these supplements for inflammation, which she had really bad. And she took these pills, and it turns out that she got like an email or something saying the pills were contaminated and that she needed to stop taking them. And they actually made her way worse. So you just really have to be careful. And there's no regulation other than like things like they can't say on TikTok, you can't say weight loss, but you can say weight management, like stupid stuff like that. That doesn't.
Oh, really?
Yeah.
Interesting. Huh. Interesting.
So, I don't know. I guess people just are going to have to stop buying this stuff, but they.
Yeah. On the one hand, I'm kind of super flattered and kind of enjoy like, the saying like no bad, bad. What is the saying about bad press? There's no such thing as bad press, kind of to some degree. Like bad press is still press.
And I think, you're saying your friends fell for it, but I know your daughter didn't fall for it. I don't think I'd fall for it. I'd be like, I know you didn't say that.
Yeah. Well, then they looked at it and they're like, oh my God, it's so real. But, they realized it wasn't me.
I guess I have to pay more attention to everything. It's just one of
those.
And
there are a lot. What's crazy is there's a whole huge TikTok of me, like a whole huge profile that's fake of me.
Yeah, I guess they're taking like this video, which will be on YouTube. I don't know how they do it, but they're taking you.
And there are a lot of followers, which is really crazy. It's gonna like bypass and surpass my own social media presence, baby.
That's the thing. No one will ever get in trouble. Apparently, like a lot of these companies are like anonymous LLCs. Before you can even file a lawsuit, they'll disappear.
Yeah, good
Who knows?
stuff. Who
Yeah.
knows?
So you wanted to talk about Lindsey Graham, a longtime South Carolina senator, passed away at the age of 71 recently.
Yeah, which is fairly young.
Yeah, I think 71's young.
Even though when I was a kid, I thought 71 was old. But now that I'm old, 71 is really young.
Well, I mean, especially if people are living a lot longer. It's not that old.
Right.
You know more about this than I do, but a medical examination revealed his cause of death was aortic dissection.
Yeah, good pronunciation there, Lauren Taylor.
Can you explain that to our audience?
So, just to back up, he was not, everybody first was like, was he poisoned? Was it some, because there are all these death threats from Iran against Trump and against his whole administration and all the politicians. So he got home from Russia, and the next thing we knew, he was dead. So there's all this, thought, was it some kind of foul play? And then I guess an autopsy showed an aortic dissection, which can't happen from foul play. It's basically, the aorta is basically a tube, a layered tube. And, normally you think just like pipes, it's basically a pipe that has many layers to it. And for whatever reason, because of either uncontrolled high blood pressure and hardening of the arteries, the layers of the tube maybe could separate. And if it separates, the blood flow doesn't necessarily, it doesn't flow, and it could even rupture and cause massive blood loss, and sudden death from an aortic rip or tear is basically what a dissection is. It's often could be traumatic from trauma, or just over time from uncontrolled, undiagnosed blood pressure, and hardening of the arteries.
Yeah, I was reading like car crashes, like that kind of trauma can cause it.
Yeah, and I think you could fact check me, listeners, or you, Lauren. I think that was the thought that that's what happened to Princess Di in her car crash.
I did look into that. Apparently, it was just, I guess, the amount of blood. It was basically like blood loss.
So it wasn't an aortic dissection. Got it. Okay. Yeah.
But it had to do with amount of blood in her body. Yeah.
Got it. Yeah. But yeah, it could be from trauma or it could be something else. Exactly.
So have you seen this? Like, I know you're not a heart surgeon, but have you seen anybody that experienced this, or did you get to watch a surgery during?
So I did have this story, this experience where it's not the same thing per se. It's an aneurysm is basically a ballooning of the blood vessel. That's what an aneurysm is. When people say you have an aneurysm, it's a ballooning of the blood vessel. And the risk of an aneurysm, a ballooning, when you think if you're blowing up a balloon, as you blow it up more and more, it gets thinner and thinner and thinner as you blow it up. And eventually it gets so thin that it pops. So that's what could happen with an aneurysm of the aorta of a blood vessel is over time, if it gets so big, it could spontaneously pop from uncontrolled high blood pressure. So I've had that happen to a patient years ago when I was a surgery resident, a mid-level surgery resident, where we diagnosed this patient in the emergency room at one of our teaching hospitals that's not necessarily equipped for super major kind of stuff. And we rushed the patient up to the operating room and opened up their belly, which was filled with blood. It had already ruptured. And the way to try to, these days, amazingly, patient gets an angiogram, where they stick catheters into the blood vessels and inject dye. These days, amazingly, there are ways to fix these aneurysms or these dissections, possibly just through the arteries, through putting catheters in there with X-ray and angiogram. Back then, they didn't really have that technology. So the only way to deal with it was you have basically like a straw burst, the middle of your straw, if you have a long tube of straw and it's flowing out blood. How do you stop the blood? Well, you go to the beginning of the straw and the end of the straw and you hold pressure around it and squeeze it so nothing's flowing through it anymore. So that's what you have to do anytime you have a blood vessel that you're worried about, is you have to get what's called proximal and distal control. You have to stop the bleeding in front of it and behind it so that there's no bleeding. So we took this patient in the OR and tried to get around the aorta. We had to, I think we actually opened up the chest and what's called cross clamp. We had to get a clamp around the aorta so it stopped bleeding. We did it, but by the time we got across his aorta, he had lost too much blood. Our blood, we just weren't ready for it. The blood bank couldn't meet up with, we couldn't get enough blood to save him. And even though we got control, we just lost him on the table. I still remember that.
Oh, that's terrible. I mean, that's what I was going to ask you about Lindsey Graham too. I mean, I guess I feel like you have to be in the emergency room, right? Like basically to save yourself, like you have to be, it has to go fast.
Yeah. If you're not in the right place at the right time, you're not going to survive that.
Yeah, that's what I thought. So that's tragic. And then you had mentioned John Ritter, the beloved actor.
Come on, knock on our door.
Three's Company,
Right.
Eight Simple Rules actor who died from a misdiagnosed aortic dissection in 2003. So I do remember that because I think his wife sued. I don't really know what happened. I don't know how you misdiagnose. I mean, people are misdiagnosed all the time. I don't know.
Well, it often presents as pain. So pain could be 80 zillion other things. It could be a heart attack. It could be an ulcer. It could be, and who knows what the history of the patient is. Is it just a patient seeking pain medicine or, so who the hell knows? You have to think all possibilities and try to figure it out. So I don't know any of the details. I just remember hearing about it, that was a misdiagnosed thing.
Yeah.
But even when you diagnose it, like we did in the ER back in the day, in the 1990s, even though we diagnosed it, got him to surgery, we were too late.
Yeah, that just seems like just a terrible thing. It seems like bad luck too. I mean, obviously there are like high blood pressure, trauma, underlying conditions. But so John Ritter, his family founded the John Ritter Foundation to raise awareness about the disease.
Oh, wow.
Yeah. So people can go to John Ritter. Yeah, johnritterfoundation.org to learn more and ways to help. But also they put out a statement, the John Ritter Foundation, after Senator Graham's death, that included some risk factors like genetic condition, high blood pressure, like you said, illicit drug use. I guess meth and cocaine can lead to it. I don't know. That's what this says on this.
Probably because those things could lead to high blood pressure.
Okay.
Is my guess. But also sometimes from the intravenous needles, well, neither of those are IV drugs, but when patients get IV drugs, if it's infected, the infection, because it goes right into the heart, those infected the bacteria could go into someone's heart and potentially cause like bacteria of the heart or blood vessels too that could rupture. But I think I'm getting a little creative there.
I was also realizing, because I was like looking up celebrities that this had happened to, and Alan Thicke from Growing Pains suffered a fatal type aortic dissection while playing hockey in 2016. I remember that because he was like playing with his son, and I was like, oh, it's so sad.
Wow, and that's how he died? I didn't realize that.
Yeah, yep. And then George C. Scott, who was an old actor, he was famous for Patton, died of a ruptured aortic aneurysm in 1999.
And that's like my patient who we weren't able to save.
Is there anything else you want to say about aortic dissection before I move on?
No, I do not want to.
Okay.
That's all I got.
Other entertainment news, I saw William Shatner, who's 95, recently announced that he had stage 4 melanoma alongside his daughter, who survived stage 4 breast cancer. So they both had stage 4 cancers, are now in remission, but he was able to survive stage 4 melanoma at age 95.
Well, when was he diagnosed with it?
I don't know exactly when he was diagnosed. He said he went to an oncologist and they operated almost immediately with stage 4 melanoma. I mean, historically, this says the survival time of that stage is less than a year. However, over the past decade, breakthroughs in immunotherapies have helped dramatically improve outcomes. I don't know when exactly he was diagnosed. He's just he was telling one of those shows about it, because him and his daughter have a new outlook on life because they both survived stage 4 cancer. And so they started a new podcast called No Time But Now.
I like the no time but now. In fact, one of my students today came to me because we had a discussion about um, she's shadowing a doctor, and the patient was recently given a diagnosis of cancer, and the patient right away said, "Doc, how much time do I have left?" And I think the doctor answered, and that's something I tend not to like to do. I don't like to give a timeline.
Right.
I may say, oh, it could be weeks, months, years. It's hard to tell, but I always try to give hope because I think there always is hope. But the
Absolutely.
student came to me today and said, well, what if the patient has a bucket list, or what if the patient has family and wants to? And I said to her, I said, speaking about William Shatner's podcast, is you could walk across the street right now and get killed. So if there's something you want to do it now. If there's family you're thinking of seeing, see them. You're never going to regret it. So
Right.
that was kind of my thought. If you have a bucket list, if there's something, do it. Don't wait to do it. So
Yeah.
what is the name of the podcast?
No Time But Now.
No Time But Now. It doesn't matter where you are. If you have cancer, if you don't have cancer, there's no time but now. I think that's brilliant.
Yeah, it is. I haven't listened to it yet. I think they just started.
Yeah. Do you know what it means when someone has stage 4 cancer?
No, I was wondering if you'd explain it. Like, I'm sure it's different for stage 4 breast cancer versus melanoma, I'd assume.
So it actually, stage 4 cancer basically means the same thing. Stage 4 just means whatever cancer it is, whatever origin, whatever cell line it originated from, whether it's breast, melanoma, lung, stage 4 means it is now spread to other parts of the body, distant parts of the body. That's what stage 4 means. That it's beyond the breast. It could be in the, in your lungs, or whatever it is. That it means it's now spread past into other parts of your bone. Who knows? That's what stage 4 means.
Right.
And stage 1 obviously is the earliest, and then 2 and 3 are kind of the intermediates. And certain stage 4 cancers are better than other stage 4 cancers. Certain stage 4 cancers are more deadly or fatal. Melanoma tends to be a more serious one when it's stage 4, just because we don't have as much good treatments for it. Breast cancer, for whatever reason, we've come up with a lot of good total body treatments for breast cancer. I think we're just better at it, and I think partly maybe because we've had more interest in it to some degree. Melanoma, we're getting better at it, but we're nowhere near we are as good as we are with breast cancer.
That's interesting. I didn't know that.
Interestingly, melanoma is one of the rare cancers that could, for whatever reason, spontaneously disappear. Unknown really why. And it could someone could have melanoma and then it kind of just regresses. And then years later, out of nowhere, it could repop back up again. It's one of those rare ones that could do that.
So it's like if someone wanted to have it removed, they couldn't because it's not showing anymore.
No. Yeah, not so much the lesion itself, but like the spread of it could just be gone and then pop back up.
Yeah, interesting.
It's a weird one.
Yeah, it all sounds terrible, but luckily they're okay. They're in remission, so that's nice.
That's beautiful. That's great. Kirk, he's the OG Kirk.
He is. And what commercial? He was always in some commercial. He's always entertaining, whatever he does.
He was in the commercial. Priceline, right?
Oh yeah, Priceline Negotiator. That's who it was.
Yeah. Is that even still a company? Is that even still around?
No,
I don't know.
Google basically owns everything now. Took over the world.
Yeah.
Another thing that I saw in the news, just because I thought it was funny. I know you like La La Land, right? That movie.
Yeah.
Ryan Gosling.
Yeah.
And this film. Anyways, it's. I guess they're putting it back into theaters for its 10th anniversary. But Ryan Gosling was on something where he talks about that poster and how he had hamburger hands because he thought he didn't know a lot about dance, and they kept telling him to do your arms like this, like Emma Stone did. But he was like, no, that doesn't look good. So he did like this. And so in the poster, he's like always humiliated because he says he has hamburger hands. And apparently, I don't think they should have changed it ever because I think it's adorable. But in the poster now for the 10th anniversary, he doesn't have hamburger hands. That's just a little Ryan Gosling story for people that love Ryan Gosling. They'll know what I'm talking
Did they fix that with AI?
Yeah.
Did I ever tell you my Ryan Gosling story?
I don't think so, but I really like him. Tell me.
My Ryan Gosling story is before Ryan Gosling was Ryan Gosling, he was in this indie movie called
Half
look up.
Nelson?
Yes. Wait, no.
Uh, Lars and the Real Girl?
No, way before that.
Hmm.
About where he's a neo-Nazi. Is that Half Nelson?
Yeah. No. That is, yes, I should know this.
He's a
I've seen him.
Jewish kid
The
who's a
Believer.
neo-Nazi. What?
Is it called The Believer?
The Believer, yes. So before Ryan Gosling was Ryan Gosling, he was in this movie called, I think it may have been one of his early movies called The Believer. And let me see, let me look up when that was. That was 2001. So that movie was made by, the director was a guy named Henry Bean, who was friends with my friend Judah Lazarus. They first made it as a short film, and Judah Lazarus played the main character in the short film. My friend Judah was a writer, director, and it's very Jewish oriented. And my friend Judah starred in the short film, and then Henry Bean got funding to make it a movie, and they cast Ryan Gosling. Judah stayed on as a consultant, and Judah had a small role in the movie as well. So Judah and Ryan got, back in the day before Ryan Gosling was Ryan Gosling, they got friendly, and I think they were even hanging out or staying together at the same place or whatever. And the movie, The Believer, was up for an award. I think at the one that they had on the beach. What award show is the one that they used?
The independent movie.
Yeah, the AFI or whatever in Santa Monica. So Judah asked me to pick up him and Ryan to help bring Ryan to award show. So I'm like, yeah, and he was just some kid. He was Ryan. He was just, so I basically drove Ryan Gosling, who was just some kid, to the award show. And that's my Ryan. And he was so quiet. We schmoozed a little bit. I was his chauffeur. Dr. Jason Cohen chauffeured Ryan Gosling to the award show. And I remember telling that story years later when Judah's brother Moshe was around, and he goes, you know what? Ryan Gosling probably tells a story how Dr. Jason Cohen drove him to the award show. Probably not, but that's my Ryan Gosling story.
You have never told me that. I love that story.
Isn't that a hysterical story?
Yeah.
I definitely have to. I definitely have to do a story time.
Supporting independent actors who grow up to be millionaires. Good for you.
Yeah, and I was his chauffeur once.
Good thing I brought up hamburger hands. This is all
exactly
going my way.
There
now.
you go. Yeah, he probably got the hands from how I was driving with my hands on the steering.
Well, it's fixed in the poster, which I disagree with, but whatever. The only other little thing I want to talk about was HBO's The Pitt earned 25 Emmy nominations, the most for this year at the 78th Primetime Emmy Awards. But one of my favorite characters is Mel King, but she has a twin sister that's autistic, Becca King, in the show. She's played by Tal Anderson, but she was recently nominated for an Emmy, and I thought that was very cool because she's very excited to have autistic representation be nominated, be shown. So I just want to give her a shout out.
That is cool. Did you continue watching it? Did you watch it till its end?
I did watch it, and she has like a good storyline in it. She's very good.
Oh, good. I really only watched the episodes we had to watch for the podcast, I have to confess.
Well, she's good, and she said that this Emmy nomination further solidifies her impact and commitment to inclusion. So that was
nice. That's awesome. And that makes me think of The Good Doctor, which also is about a doctor on the spectrum. And that was produced by or written by Lindsey Graham.
And she's on one of our podcasts. She's fascinating. Listen to that. I mean, how she...
Yeah, Lindsey Graham, who was one of our guests, who produced and helped create the Good Doctor also.
Yep. Which
it all ties in.
Yeah, and that show went on for 8 seasons. So if you want to check out that episode about, if you want to learn more about The Good Doctor and how it got made, listen to Lindsey Goffman episode.
Very cool.
But yeah, so that's good. That's all I got for today.
I think that's good stuff, Lauren Taylor.
Yeah, that's all I saw in the entertainment meets health realm.
What are you consuming anything lately?
I'm watching Sugar on Apple. It's with Colin Farrell. It's season 2. I can't explain it to you. I mean, so he's a PI, but there's way more to it than that. But it's very like classic Hollywood. Like it always intersects with all these like flashes of like old Hollywood movies, and he's obsessed with old Hollywood. And you learn later kind of why. But it's kind of slow, but it's a very pretty show. I don't know. It's very calming. Not selling it, but it's good.
I doubt I'll be watching it. I'm looking forward to the final season of The Bear, I think, is coming out.
You haven't seen that yet?
The newest season?
Yeah, I saw that.
No, I just saw posters on it.
All right, we'll talk about it.
The final season, right? The final season? It's
Yeah,
already out?
we binged that like 2 weekends ago. It's really.
I didn't know it was out already.
Mhm. They're like short episodes. They're like 20 minutes. It's we have to talk about it.
Okay. But I did watch that one-off, that prequel one-off with Richie. That was awful. I think I told you about it.
Well, yeah. What was it called? Something about the place where they were.
Yeah. I forget.
It was sad. It was dark.
You saw that?
I did see it. I mean, it's about someone being bipolar, and it's hard to watch.
Yeah. But it wasn't, yeah, it just, I hate things that are hard to watch like that.
Yeah, it was because he's such a good actor, John Bernthal.
They're both great.
Yeah, who I actually, he's from the DC area, so I saw him in a restaurant the other day. But he's
Did you say hello?
No, but I got to watch him eat, and it's fun to watch celebrities eat because they don't eat carbs at all. So like he literally ate like a piece of lettuce while his like wife and other couple were like eating everything, and I was like, yep, that's what I thought.
Nice. Did you take like a bogus selfie with him in the background?
No, I mean, I always think like leave celebrities alone. I mean, I know whatever, it's kind of like the athlete thing. They're paid if they have a great life. I'm sure a lot of them don't mind, but I feel like if you're with your family or something, I don't know.
Yeah. Although I love when I have I guess because I'm not a real celebrity, I love when people who have seen me on social media or my podcast, I love when they approach me. I wish people would do it more. I often get the sense that people look at me like at the hospital, who I know, but who I don't know, who look at me like knowing. Like today, after the Sim Center with the students, I was walking out and I was saying thank you and goodbye to, I don't know if she was a charge nurse or the head administrator, and she just randomly said, "Oh, I saw you on social media," and I didn't know who she was. And she's like, "Oh, I saw you, and you're good. It was fun. It was good," and that was really cool. I love that she did that.
Yeah.
Yeah.
I mean, yeah, maybe he would enjoy a shout out. I don't know. I always just think leave him alone, but you're probably right.
Yeah. No, I know. You never know.
Yeah. I just enjoyed him eating no carbs. It was fun for me to watch while I ate at an Italian restaurant eating a lot of carbs.
Very good.
Yes.
Very good.
What else am I doing? No, I asked you first. I'm just kidding.
What else am I doing? My kids want me to watch I Never Will, Obsession.
Yeah. I know what you're talking about. I'm not like jealous is the wrong word, but I'm like, good for you.
I'm jealous.
Yeah.
They made it for like $0 and it's made like supposedly $500 million or something.
And now he has every studio coming to him for deals to make whatever he wants. I'm like, that's the dream.
Yeah, that's pretty amazing. I am also jealous. And it was a simple premise too, Nothing really complicated about it.
I know. My brother saw it just for the reason to like, investigate, basically like see what this movie is. And when he explained it to me, I was like, wait, that's it? And he was like, yep. I was like, wow.
Yeah. One of my daughters saw it twice and wants me to watch it again with her. And I'm like, yeah. And she's like, why don't you want to watch it? I'm like, I don't like being scared. Plain and simple.
Yeah. I mean, I don't either, but I'm like, I don't know. I don't feel like I need to watch it. But.
No. We're watching Silo for some reason right now.
I started that show. I don't know how I feel about it. How do you feel
It's
about it?
interesting.
Yeah.
It's kind of interesting, fun, dystopian. Um, I think it's worth a watch. Good actors and actresses in it, so I think it's worth a watch.
Okay. Well, we're both watching Apple shows.
All right, everybody. Thanks for watching, listening to us, and uh, we love when we hear from you. I love when I hear from you. If you see me, stop me, say hello, DM us, text us, whatever it is. Give us feedbacks, questions, comments. Gross Anatomy Instagram, Gross Anatomy Podcast Instagram, TikTok, and all sorts of things.
That's it for this week. Thanks for listening to Gross Anatomy, and be sure to subscribe to our podcast so you can check out more episodes on the evolving sights, smells, and sounds of medicine. Gross Anatomy is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.